Hi everyone, and welcome to a quick rundown of some of the groundbreaking things we saw at Arab Health 2025. If you thought healthcare was moving slowly, think again. Arab Health was a whirlwind of innovation. We're talking robots doing blood draws with superhuman precision and AI avatars that can diagnose patients speaking different languages, all at the same time. It's like stepping into a sci-fi movie, but it's happening now.
Fascinating doesn't even begin to cover it. It's almost hard to believe, isn't it? Think about it. Just a generation or two ago, medical tools were largely mechanical, and now we're talking AI and robotics. So the question is, how did we get here? How did we get from basic medical tools to what sounds like science fiction becoming reality? What were the key turning points? Was it the internet? The smartphone? The Human Genome Project? It's likely a combination of all these things and more. It's the power of human curiosity, relentless research, and the incredible synergy between different fields of science and technology that has propelled us forward at warp speed. And Arab Health is like a living testament to that incredible acceleration.
Seriously, it's almost unbelievable. Electric hospital beds is the pinnacle of innovation at the first Arab Health in 1975. I can almost picture the brochures. Experience the luxury of adjustable elevation. And here we are today at Arab Health 2025 with cold plasma devices that sound like something out of a science fiction movie, zapping wounds with ionized gas and magically making them heal twice as fast. It's like going from a rotary phone to a quantum computer in the span of a human lifetime. It's both astonishing and a little bit hilarious when you think about the sheer gap between those two eras of medical technology. Talk about progress on steroids.
Absolutely. Let's really let that sink in. In the 1800s, not that long ago in the grand scheme of history, doctors were still reaching for the leeches, literally bloodletting, and essentially operating on educated guesses, often based on theories that were frankly wildly inaccurate. It's almost shocking to think about the level of uncertainty and even, dare I say, barbarity in medical practice just a couple of centuries ago. And you're spot on. The pace of innovation hasn't just increased, it's exploded exponentially. We've gone from an era of medical guesswork to one driven by rigorous scientific method, data analysis, and now the incredible power of AI and robotics. It's a complete transformation, a scientific revolution playing out before our eyes.
Right? The speed of innovation is dizzying. And when you see something like the robot phlebotomist in action, it really hits home. They're claiming a 99.8% success rate on first stick attempts. Does that number sound impressive to you? Well, consider this. The average human success rate is around 70%. That's almost a 30 percentage point difference. Think about your own experiences with blood draws. Have you ever had multiple pokes? It's not fun, right? This robot technology isn't just about cool gadgets. It's about fundamentally improving the patient experience. It's about reducing pain, minimizing anxiety, and making a routine medical procedure significantly less stressful. Is that a game changer for patient comfort? Absolutely. And it's driven by this incredible acceleration in technological capabilities.
Mhm. That's such a key point to raise. We get excited about the tech, but what about the human element? How do patients actually react to the idea of a robot drawing their blood? It's a natural concern, and it highlights a crucial nuance. It's not about replacing human interaction entirely, is it? In fact, some might argue that by automating routine tasks like phlebotomy with robots, we can actually free up human healthcare professionals to focus more on the truly human aspects of care. The empathy, the communication, the emotional support. Perhaps the robot handles the technical precision, while the human nurse or phlebotomist can spend more time explaining the procedure, addressing patient anxieties, and providing that vital human connection in other areas of their care journey. It's about strategically leveraging technology to enhance human interaction, not diminish it.
Exactly. And the data is fascinating. Those initial studies showing 85% patient comfortable with the robot phlebotomist because of its perceived accuracy really speak volumes. It suggests that patients are increasingly data-driven in their trust. They value competence and reliability. And if a robot can demonstrably perform a task better, they are surprisingly open to it. But you're absolutely right to keep us grounded in the human element. And that's precisely where the intelligent application of AI comes in. It's not about robots replacing doctors and nurses wholesale. It's about strategically shifting roles. Let AI excel at the tasks it's best suited for, like precise, repetitive procedures, while simultaneously empowering human medical professionals to focus on the uniquely human aspects of care, building rapport, providing emotional support, having in-depth conversations about treatment plans, and truly connecting with patients on a human level. It's about augmenting human capabilities, not erasing them.
The AI voice analysis system? Completely game-changing. Detecting respiratory distress from speech alone? It sounds like something from the future, but it's here now. And you're spot on about remote healthcare. This has the potential to completely revolutionize how we deliver care outside of traditional settings. Think about the sheer scale of impact. Suddenly, we can extend sophisticated diagnostic capabilities to millions, even billions of people globally, regardless of their location or access to medical facilities. This isn't just about convenience. It's about fundamentally transforming healthcare delivery, making it more preventative, more personalized, and far more responsive to individual needs, especially in respiratory conditions, which are so time-sensitive.
Definitely. And what's really impressive is the early warning aspect of this AI voice analysis. It can pick up on subtle changes in speech that indicate respiratory distress up to 48 hours before typical symptoms even show up. That's a significant window of time. And to see it being trialed in rural clinics across Southeast Asia is really encouraging. You can immediately see the potential for places like the Australian outback. For communities spread out across vast distances, having a system that can detect problems early without needing specialist equipment or travel could be a game changer for preventative health care.
Though we should probably discuss some of the challenges these technologies face in real-world implementation.
You're absolutely right. Those solar-powered mobile clinics are fantastic, operating completely off-grid, a real boon for remote healthcare. But they also underscore a key point. Even the most cutting-edge tech needs human support. Trained staff are essential for maintenance and long-term success. And that's what was so impressive about Araba Health 2025. It wasn't just about the gadgets and the groundbreaking technologies. The conference actually dedicated a full track to addressing these very practical, down-to-earth challenges. It was a welcome reminder that true innovation in healthcare isn't just about invention. It's about effective implementation and sustainable solutions that work in the real world.
Precisely. And decentralization of healthcare is definitely the key takeaway, isn't it? It's like all these innovations are pointing in the same direction. For decades, healthcare has been largely centralized, built around hospitals and specialist centers. But now, we're seeing the confluence of technologies, AI, mobile connectivity, renewable energy, advanced diagnostics, that are finally making true decentralization a real possibility. These technologies are empowering us to break down those centralized structures and distribute healthcare services more effectively, more equitably, and more efficiently. It's the convergence of these breakthroughs that's driving this major trend and fundamentally changing the landscape of healthcare as we know it.
Exactly. And those aren't just vague predictions, they're data-backed projections. By 2030, the experts are forecasting that around 40% of all medical consultations will have shifted away from traditional hospitals. Think of the sheer volume of consultations that represents. Delivered in homes, pharmacies becoming more integrated into primary care, and these innovative mobile units filling the gaps in access. It's a massive decentralization driven by technology and a clear patient need, But if you think that's transformative, wait until you hear about what absolutely blew my mind at Arab Health, the holographic hospital demonstration.
Oh, without a doubt, the holographic hospital and those AI gardens were the visual highlight of the conference for many, myself included. That demonstration of personalized medicine, grown in these digitally orchestrated gardens within a holographic hospital setting, was incredibly powerful. It beautifully illustrated the potential convergence of AI, biotechnology, and personalized care. But your point about the timeline is crucial, and it's a question I had immediately as well. While the demonstration was compelling, the practical steps to get from that concept to a functioning real-world system are enormous. What are the regulatory hurdles? The scalability challenges? The ethical considerations? The timeline for something that ambitious is certainly complex, and it's something I'd love to understand more about. The realistic milestones and the potential roadblocks along the way.
2040, that's the target for fully holographic hospitals, according to the keynote. And while that might seem like a long time, it's important to remember that these kinds of revolutionary changes often happen incrementally. It's not going to be an overnight switch. But what's truly significant is that some elements, as you mentioned, are already moving from concept to reality. The AI-driven diagnostic systems, that's not a future promise. That's happening in hospitals and clinics today. That's the crucial takeaway. The building blocks of this futuristic vision are already being put in place. The diagnostic intelligence, the AI power, is starting to make a real difference in patient care right now, even as we work towards those more ambitious holographic facilities down the line.
The integration of mental health monitoring into everyday technology raises some interesting privacy concerns, though.
You're absolutely right. It all comes down to making it real, making it implementable. And a huge hurdle is always going to be privacy. But what if I told you they've found a way to address that head on? They're pioneering something called Privacy First AI. Let's just think about that for a moment. Instead of your health data going out there, imagine it being processed right here on your own device. Does that sound like something that would make you feel more comfortable? Well, the conference participants certainly thought so. An overwhelming 92% of patients said they'd be willing to share their health data. Think about that number. But only if they're in control. Privacy First AI offers exactly that control, and that's why it's such a promising direction.
Let me share something interesting about the cold plasma technology. It's actually based on research from the 1960s that we're only now able to implement safely.
Now, the burning question is always, how do we actually do this? Well, what if I told you that strategic implementation of these technologies isn't just a nice idea, but a proven path to both cost savings and better care? They demonstrated how we could potentially reduce healthcare costs by a staggering 30%, while, crucially, enhancing patient outcomes. How? By being smart about where we place technology. Think of it as a division of labor. AI can become the tireless workhorse, handling the routine, the predictable, freeing up our incredible human healthcare professionals to dedicate their skills and compassion to the truly complex situations, the cases that demand a nuanced understanding and a human connection. It's about leveraging the best of both worlds to create a healthcare system that is both efficient and deeply human.
Though we should note that many of these technologies are still in early development phases.
Well, that brings us to the end of our time today. The takeaway seems clear. Healthcare is becoming more accessible, more precise, and potentially more human, despite, or perhaps because of, all this technology.
And perhaps the most unexpected and ultimately hopeful insight we can glean from all of this is that technology, rather than diminishing our humanity, can actually serve to amplify it in the realm of care. It's a paradigm shift, really, to consider that these tools can empower us to be more present, more effective, and ultimately more human in our caregiving. This is a complex and evolving discussion, and if you're interested in exploring the nuances of this further, I wholeheartedly encourage you to contact Dimitri. He's deeply knowledgeable in this area, and would welcome the opportunity to delve into this with you. Thank you for tuning in. See you next time.